Hello everyone, today we'll learn how to adjust the WBC count when your sample is contaminated by a bloody tap. Accurate WBC count is crucial for ruling out infection and distinguishing between different causes. However, when the sample contains blood, it becomes challenging to determine if the WBCs were originally present or introduced by the bloody tap. Say you performed a lumbar puncture and despite the fluid appearing clear, it contains 1400 RBCs and 7 WBC. Given that the patient presented with headaches and fever, the question arises whether this is bacterial or aseptic meningitis. The WBC count of 7 complicates the interpretation. However, there is a method to adjust for potential blood contamination in the sample. Let's explore how to adjust the WBC count to account for any accidental blood contamination in the sample. Let's consider a fluid sample that shows 2 WBCs. If you perform the procedure without any blood vessel injury, you would have a WBC count of 2. However, if some blood accidentally mixed into the sample, you would see an elevated WBC count, in this case 3. So you need to adjust for this contamination. You notice that there is a 1 WBC for every 6 RBCs in the sample. Since labs give you RBC count in the sample as well, you can subtract 1 WBC for every 6 RBCs in this case and get a correct value of 2. Every patient has their own WBC to RBC ratio, which changes with underlying condition. These numbers are always reported on a complete blood count. In this case, white cell count is 11.7 thousand and your RBC count is 4.21 million per millimeter cube. When you divide this and multiply by 1000, you will get a ratio of 2.8 WBC per 1000 RBCs in this patient. Some textbook will use ratio of 1 WBC per 600 RBCs as correction factor. I will suggest using patient-specific information rather than this generalized number, as the ratio varies widely and sometimes on daily basis. So let's look at the same case. Your white cell count is 7 and your RBC count is 1400 per millimeter cube. You looked at the CBC and you found that the RBC count is 4 million per millimeter cube and WBC count is 20,000 per millimeter cube. So for every 4 into 10 raised power 6 RBCs, there is 20 into 10 raised power 3 WBCs. So for 1400 RBCs in the sample, there will be around 7 WBC. So to correct for this, you subtract 7 from the white cell count in the CSF sample. So that gives us 0. So seems like all the WBCs in the CSF came from the bloody tap. So it would appear that this patient may have aseptic meningitis. One of the things you have to make sure that there is no underlying pathology which can cause bleeding into the body fluid. You cannot really correct for those. For example, if your patient has hemothorax, hemoperitoneum, etc. So how do you figure out if the blood that you see is an old blood or a new blood from your tap? And the way to figure it out is looking at the type of RBCs present. If they are deformed RBCs, most likely these were present previously in the body fluid. The other things that can give you some idea would be broken RBCs. There will be free hemoglobin in the fluid and you can see xanthochromia. Let's do another example. You performed a paracentesis and found that PMN count is 250 and your RBC count is 40,000. The question is, does your patient has spontaneous bacterial peritonitis? You look at the CBC and found the RBC count to be 5 million and WBC count of 10,000. Since 80% are PMNs, will take 80% of the WBC count. So for every 5 million RBCs, there will be 0.8 into 10,000 PMNs. So for 40,000 RBCs which were present in the sample, there will be 64 PMNs. So actual PMN count will be 250 minus 64, that's 186. So this patient may not have spontaneous bacterial peritonitis. However, when you look closely, you see some of these RBCs are deformed. So it may appear that this RBCs were from a previous tap. So you cannot really correct for the WBC count in this case. So this patient may really have spontaneous bacterial peritonitis. In summary, if your body fluid are contaminated by blood, you can use the patient ratio of RBC to WBC to correct for the white cell count that is present in the sample. Make sure that the blood was from the bloody tap rather than being primarily present in the fluid sample. Some features that would suggest older blood include deformed RBCs, broken RBCs, free hemoglobin in the fluid, and xanthochromia. Always use your clinical judgment in interpreting the WBC count. There's always a range and patient can present early, so keep your differentials broad. Thank you.